Hi everyone, let's talk about the posterior compartment of the forearm. So much like the anterior compartment of the forearm, the posterior compartment of the forearm can be conceptualized in layers of muscle. And very thankfully for you all, our focus is going to be on the muscles of the superficial layer. Now, before we get into the meat of this, no pun intended, I'd like to draw your attention to this muscle here that I'm outlining. This muscle is known as the anconeus or anconeus muscle. Sources vary with respect to the placement of the anconeus within either the posterior forearm or the posterior arm. It is innervated by the radial nerve. It is an extensor of the forearm and a stabilizer of the elbow joint. Its role today is primarily just for location. So, for instance, let me just remember with pronator teres, it helped to guide our focus with respect to the anterior forearm. Well, anconeus is going to guide our focus with respect to the posterior forearm. So what I'm going to do now is circle all of the muscles that we'll be talking about today in the extensor compartment. And that's going to leave out this muscle here. This muscle, believe it or not, is the belly for our good friend flexor carpi ulnaris.
Sorry, I don't know that one.
Thank you very much, Alexa. Flexor carpi ulnaris is a muscle of the anterior compartment, if you recall, and most of its belly is only visible in the posterior view, such as this. So let's take a look at what we can see. So most of these muscles are going to originate on the common extensor tendon, and we can see that here. And that tendon is going directly to the lateral epicondyle of the humerus. So again, let's kind of establish our borders here. So this is lateral or radial side. And then this is medial or ulnar side. Radial side or lateral is always going to be the thumb side or the first phalanx, for your knowledge. So the first two muscles that I'd like to mention are brachioradialis and extensor carpi radialis longus. That is quite a name. So brachioradialis here is this muscle that I'm highlighting. If you recall from our discussion of the anterior compartment of the forearm, we could see quite a bit of brachioradialis there. It is attaching, its proximal attachment is just proximal to the lateral epicondyle, so above that common extensor tendon. And it's going down to attach to the distal radius, if you recall. So this is going to be another muscle to help with elbow flexion. Just inferior from brachioradialis is this muscle here, as we can see. It's also inserting just proximal to that common extensor tendon. This is extensor carpi radialis longus muscle, and it's running from its proximal attachment, just proximal to the common extensor tendon, down to the second metacarpal. And this muscle here is going to be very important for extension of the wrist and abduction of the wrist or the radiocarpal joint. So that would be deviation of the wrist laterally or radially. Okay, our next muscle with an equally impressively long name is the extensor carpi radialis brevis muscle. Extensor carpi radialis brevis is going to be one of the first muscles that takes its origin or its proximal attachment from that common extensor tendon there. So I'm going to be reiterating this quite a bit. So that's the common extensor tendon. And it's coming down like so. We can see it there. And it's going to distally attach or insert on the third metacarpal. And so this is also going to be yet another extensor of the radiocarpal or wrist joint. And it's going to be another abductor of the radiocarpal joint. So extensor carpi radialis longus and brevis here are going to have the same actions, although they'll have slightly different attachments from one another. All right, our next muscle here, extensor digitorum. Oh, I should say that extensor carpi radialis brevis is actually the prime mover of wrist extension. So it's the muscle that's really driving that motion. So next up in the lineup is extensor digitorum. So extensor digitorum is originating from the common extensor tendon, coming down like so, and its tendons are running out to the extensor expansions of digits 2, 3, 4, and 5. And so these are crossing a lot of joints. And each of the joints that extensor digitorum tendons cross will be extended by extensor digitorum. So for instance, it's going to extend the wrist joint, so that radiocarpal joint, the metacarpal phalangeal joint, the proximal interphalangeal joints, and the distal interphalangeal joints as well. So extensor digitorum is doing quite a bit for us. There also tends to be, as it's moving under the extensor retinaculum there, tendinous intersections between these tendons of the muscle, which sometimes makes for difficult independent movement in terms of extension of these digits as an individual tries to extend them. The next muscle is extensor digiti minimi. Digiti minimi is referring to good old digit 5, the pinky there. And oftentimes its belly is kind of fused with extensor digitorum, so we can see a little bit of extensor digiti minimi. So ultimately, it's taking its origin or its proximal attachment from that common extensor tendon, and it has its very own tendon down into the extensor expansion of digit 5. So it's going to allow for extension of the radiocarpal, the metacarpal phalangeal joint of 5, and the proximal and distal interphalangeal joints of digit 5 as well. And owing to this independent nature of the tendon, this muscle allows us to independently extend the fifth digit or the pinky. So if you think about yourselves being fancy during tea, or fancy holding your mobile device, or just fancy in general with your extended pinky, you can thank extensor digiti minimi for that. The next and final muscle of our superficial muscle tour is extensor carpi ulnaris. Extensor carpi ulnaris is a rather robust muscle taking its origin from, yes, you guessed it, the common extensor tendon. I'll just outline this muscle here going down. And its distal attachment is going to be the fifth metacarpal. And so extensor carpi ulnaris is going to be another extensor of the radiocarpal or wrist joint, and it's also going to be an adductor of the wrist joint, so it will allow the hand to deviate medially or towards the ulnar side for a wave. Now we can go a little deep to that. We've removed extensor digitorum and extensor digiti minimi and extensor carpi ulnaris here, and we can see the deep muscles. And there are a few deep muscles to be seen here, but thankfully for you all, there's but one to focus on here, and I'll outline it. It's got such a cool name. It's called the supinator. The supinator takes its proximal attachment or its origin from the lateral epicondyle, not the common extensor tendon though, as well as portions of the ulna and annular ligament, and it's then going to insert or distally attach on the lateral aspect of the proximal radius here, so we can see kind of there. And when it's active, it is going to, as its name suggests, supinate the forearm at the elbow joint. So that's the extensor or posterior compartment of the forearm. Thank you for your time.